Here we're looking at children's sleep. So this is published in Medical Principles and Practice. All of these are peer-reviewed papers. They're published in PubMed. And in quotes, allergic symptoms, daytime mouth breathing, shaking the child for apnea, restless sleep, and hyperactivity were significant and independent risk factors and sleep-related symptoms for habitual snoring. So the two factors we're looking at is allergic symptoms. Child has an allergy, pollen in the air, nose gets blocked, they open their mouth, and there's two factors that are going to contribute to sleep-related symptoms. Another paper is published, or it's entitled Allergic Rhinitis, More Than Just a Stuffy Nose. The title itself will tell you something about what it's going to say. Allergic rhinitis is more than just sneezing and an itchy nose. Complications of this disease are numerous and can have a significant impact both mentally and physically. This is with regards to children. Mental functions such as learning, sleep and activity levels can deteriorate, and eustachian tubes, sinuses and airway functions can be affected. There's quite a few more papers with regards to children, but here I've changed it a little bit, and we're looking at the effects of mouth breathing from a young age of a child. And in quotes, a mouth breather lowers the tongue position to facilitate the flow of air into the expanding lungs. Basically, when your mouth is closed, your tongue rests up in the roof of the mouth. And when your tongue rests in the roof of the mouth, your top jaw will form around the shape of your tongue. Your tongue is U-shaped, and it results in a wide top jaw. But if you have your mouth open, you cannot have 3/4 of your tongue resting in the roof of the mouth. Try it. Try and breathe through your mouth and at the same time have the tongue in the correct resting position, which is up in the roof of the mouth. And it's impossible. So mouth breathing children don't rest their tongue in the roof of the mouth, they have it midway or on the floor of the mouth. And it's the action of the tongue and the position of the tongue that dictates the shape of the top jaw. That's why all mouth breathers tend to have crooked teeth, because the tongue isn't resting up there forming the shape of the top jaw. But it's not just that. The lower jaw, if the tongue is up there, the jaws will grow forwards. Whereas when the tongue is resting midway or on the floor of the mouth, the jaws come back. My jaws are set back. And how do you know? You know by there's usually excess skin here. My jaws should be more forward, but as a result of mouth breathing, my jaws are set back from their ideal position, and they will have a tendency of coming in on the airways. That's why people with respiratory complaints such as asthma, some papers show that up to 74% of asthmatics have a high risk for sleep apnea. And the reason being is because of the respiratory complaints. So the resultant effect of mouth breathing in children is maldevelopment of the jaw in particular, and deformity of the face in general. Setting of the teeth on the jaw is also affected, and all these make the face look negative. Generally in Ireland, as regards orthodontics, we wait until the child is 11 or 12 years of age. Child has crooked teeth, and extractions are made. The problem is not that the teeth are too big, the problem is that the jaw is too small. And the jaw is too small because the tongue hasn't been resting up in the roof of the mouth. And parents will spend thousands trying to improve their children's faces and teeth, but straight teeth will not create a good-looking face. But good-looking face will create straight teeth. A good-looking face grows the way it should grow, but when the mouth is open, the face will grow differently. Does that make sense? Yeah. Here's an example. This boy, Professor John Mew, was working with a statistician at the time. It's going back about 20, 30 years ago. And Professor Mew was talking to the statistician about the effects of open mouth breathing. And the statistician said to him, "Do you know what?" He said, "I think that happened to my child." And Professor Mew said, "Well, do you have photographs?" Here are the photographs. This boy is 10 years of age. He's a nose breather. He has a good-looking broad face with everything in proportion. Nice broad face. On his 14th birthday, he was given a gerbil or a hamster as a present, and he took an allergic reaction to it, causing him to breathe through his mouth. So his nose blocked, so he opened his mouth to breathe through it. His face shaped. The shape of his face changed in the 3 years and changed quite considerably. you see the narrow facial structure, but you also see the lower jaws coming back in on the airways. I see these faces all the time for 10 years. And the only reason that this child's face shape changed the way it did was because the child had its mouth open. Very few health professionals look at this, unfortunately, but we are making some ground. There's a magazine, General Dentist, or not General Dentist, Irish Dentist, which is distributed to every dentist in the country. And in June's edition, they published a paper on this, or published an article, and it includes exactly it's my article, but we included all the research and some of the photographs to make dentists and people in the health professions more aware of the negative effects of open mouth breathing. Okay, so dentists will be becoming more aware of it. Oral mouth breathing in children may lead to the development of facial structural abnormalities associated with sleep disordered breathing. We postulate that the switch to oronasal breathing, which is breathing through the nose and mouth, that occurs with chronic nasal obstruction or conditions, is a final common pathway for the sleep disordered breathing.